The topic that we're obviously talking about today was obviously in relation to substance misuse, workplace substance misuse, and looking at obviously the strategies that go with that and our specialist remit within that, and kind of asking that question of, is your strategy helping or hindering the mental health of your staff? So hopefully by the time we come to this, we'll be able to, by the end of it, we'll be able to have a sort of a conversation or another look at maybe are there other alternatives that can potentially be out there. So as you say, just a sort of a brief agenda to kind of set the scene a bit, and again got some stats in there, but I don't want it to be death by stats, but I think it just helps to kind of formalize and show where we are, you know, with the sort of the problem that's there. We then look at what makes up an effective strategy in terms of what business is doing and what should you be looking to do, the different approaches that can be taken, some of the challenges or unique challenges, should I say, that faces the construction industry, and then looking at how we can create a meaningful change and what are the sort of alternatives or things that we can look at to develop that to obviously support the mental health and the well-being of your staff. So if I just give you a bit of background to who we are, so from Positive Matters, real briefly. So there's two of us, there's two co-founders of it, and we, as it says on there, we specialise in modernised best practice strategies for substance misuse. We both came from a large testing organisation, so we've kind of sat the other side of the fence in terms of the testing regime. We've looked after sort of government contracts, large workplace customers, a lot of construction industry, rail, so the whole breadth of what looks after in terms of employees, and then obviously the benefits that then brings to. I
think that's Joanna coming back in.
Yeah, coming back in. Hi, John. Yeah. So from that perspective, but the main thing that we look at is obviously to remain independent, and we kind of be a bit more innovative in terms of our approach. And it will come on to why we kind of set up in the first place, was we really saw that there was this evolving problem within the industry, and it was kind of one approach was being used to kind of manage that, and that was just to test. And there needed to be a bit of a better solution in our eyes to that. So we're very much around a sort of prevention approach and how do we actually engage with employees to try and stop it from happening in the first place rather than just reacting to a test. So just to kind of set the scene, this is where we kind of talk around the sort of a few of the stats and a few things from there. So, you know, from COVID times and, you know, the economic downturns, upturns, whatever sort of page you're looking at in the newspaper now, there's a lot of pressure on people in work and out of work, I guess. But obviously the fast-paced life, it can lead to stresses and anxieties and pressures, and then how are people coping and moving to deal with those mechanisms? And it's a lot of those are, or should I say not all of them, but unhealthy mechanisms to be able to cope with these stresses. So just to show you from Alcohol Change, they put only 1 in 5 drinkers who are dependent are actually receiving treatment. Okay, and the one that came out recently was around nearly 2/3 of people who reported drinking alcohol use it for work-related reasons, stress-related reasons. So it kind of sets that kind of image that, you know, people are self-medicating, and how are they getting through their problems? They're turning to drink or to drugs potentially to kind of numb the pain or to get through just the working week, which is obviously problematic. In terms of the sort of the drug use and things like that, you know, you don't need me to sort of sit here and say, you know, we've got a problem. Yeah, it's in the papers, it's everywhere to say that. But in terms of, if you look at ONS stats, you know, 10% of the working population reported that they used drugs in the past 12 months. Okay, that's quite a large number, I would suggest. But then you look at things like cocaine. It's just as a sort of a random kind of stat. It's the UK is the second biggest consumer of cocaine globally. The first of which, I don't know, ask it out to the thing. Does anybody guess who the first on that list is?
States?
No, it's actually Australia is actually the number one from this report that was out in the BBC and the Times last year, which is quite strange. I thought it would be someone like America with obviously their large population, but I think that just kind of highlights the UK in terms of obviously, the consumption of cocaine, but that kind of goes hand in hand with our drinking culture. And obviously from previous episode or groups that we've been on, Jenny, Nick and talking around, his experiences. Nick O'Shea is brilliant. For anyone who hasn't heard Nick speak, it's a really enlightening and fantastic sort of insight into that construction worker and how that evolved from just down the pub to then moving on to other things, and that kind of goes hand in hand with what we're seeing in terms of the use. But there's also a huge.
Nick, I was going to say, is there a age kind of demographic that's different now? Because when we hear people talking about, say, the drinking culture seems to be lesser in the younger generation, but the drug culture perhaps is still increasing as present. So you kind of think they go hand in hand, but I'm wondering if there's going to be a shift in that kind of attitude to it.
Yeah, I think you're probably right, Jenny. I think there will be a sort of a shift as we see in less the sort of the younger generations are choosing to less alcohol, but there may well be that shift. And there are certainly things that we're seeing. So ketamine use at the moment is a huge increase. So, and we can kind of talk about panels and what people should be testing for. But I would certainly recommend anybody that doesn't have ketamine on their sort of drug testing panel should potentially look at that, because there is a huge increase. And there's actually a BBC report that came out with a young, I think she was 16, and she started using ketamine because it was just to take away the stresses of the mental health issues that she was sort of struggling with. So I can share all of those afterwards if you wanted to have a look at them. But I think that's the kind of, as you say, the shift in terms of people looking for other substances. There's things like nitazines that you're seeing and cannabis vapes and those sort of things. So nitazine's a synthetic drug, which is probably about 200-300 times more potent than heroin, which you then kind of seeing cut with other drugs. So there's a large problem in the US around deaths around that, and they're starting to see that slowly creeping into the UK. Unfortunately, we tend to follow the sort of the trends from the US come across the pond to the UK. But not all doom and gloom. I don't want to sort of scaremonger people into it, but it's just to kind of give you the highlight of what's going on, in society. And this is a societal problem, I think, is the first and foremost, is to kind of say that. But then naturally blurs the lines then between what goes on in society and what takes place in the workplace. So from that perspective, and it is really looking at that thing to say, workplaces have become sort of outsourced provision of education around societal problems. So I think just to kind of say this isn't a workplace problem, this is a societal problem, you're kind of being a bit shut off. You need to open the door to kind of say, we need to address this, or we need to inform our workers around what are the problems out there. And obviously, as we talk through the rest of the slides and the talk today, we'll see how that's affecting people's mental health and the problems with that. Just very quickly on these ones, I just wanted to show. So this is taken from Gov UK. So this actually shows the number of people that actually were receiving treatment last year for alcohol or drugs. And that's actually a 7% increase on the previous year.
Still feels a low number though, Nick.
Yeah, I know. Yeah. And that's what I was going to say, is it's a very low number when you think about the problem that's out there. So these are the people that are actually saying, yeah, I've got a problem and I need some help and support. Interestingly, of those, 72% of them, when they sort of started the treatment, stated at least one mental health need at that point. So this kind of shows you that they're not running sort of parallel, substance misuse and mental health issues running parallel. They are the same problem. They're intertwined. It's twisted through. So when we're kind of talking around this, you have to kind of address both. You can't address one without the other. So from that perspective. Interestingly, the other part of that is that 22% of people that stated, from that 72, only 22% of people actually were receiving support for that. So that's quite a large drop off from, although there is a mental health need, those people aren't actually receiving any support at all to address it. And then the final one is just then there was a 37% dropout rate of those people there. So again, even people that started support didn't actually finish it. So it's how do you keep people in support from there to help and ensure that they are getting the help and the need that they need essentially from that. So what is the approach to take? So what do you take? So we've seen all kind of strategies from when we've been doing work. Our approach is it needs to be a strategy, not just a policy and test. You know, that I suppose in some ways you could argue is a policy, but is it really? It needs to be a bit more detailed than that. We review a number of policies, and some of them are just statements, I would say, rather than policies. It's, you know, written on the back of a post-it note. So when we're looking at working with organisations or advising, it's, well, anyone that's on the call as well, I guess, is to help and address, to just take that minute to think about, okay, what do we actually want to do? What is the strategy, and how do we embed this into an overall piece, rather than just, oh, we've got to do some testing, let's just get something that allows us to test. So simple terms, we use the analogy of sort of pets for companies to kind of review and look at. And if I go through each one, and then I'll kind of look at where the issues are within the industry as well, certainly within the construction industry, that we see. So obviously, first one, starting off with policy and procedures. So obviously making sure that there's something there that's legally defensible from an organisation's perspective, but it's also got to be robust and fair to what they're looking to do. What we have seen is a number of sort of copy and pastes. So they will just go from, you know, one person leaves an organisation, they'll go and work for another, and it will be a case of, okay, well, I'll just take that policy with me and I'll just drop that in, change the name on it, and away we go. It needs to be a bit more than that now. You're looking at, you know, the values, the culture of each individual business. How do you make sure that those are reflected in what you're doing? And also then, how does that then come through into your education and awareness and your support? So leading on to that education piece of, what are you doing? You know, what are you actually doing to tell people what are the rules? What are the expectations from somebody that's coming onto site? Can you go down the pub at lunchtime and have a drink? Does your policy allow you to do that? You might not be under the influence, or, you know, be above the set limit, but are you allowed to go and have an alcoholic drink in work time? Those are the sort of things where we feel that people are falling down.
You know, I see, Nick, as well, sometimes it's things like, oh, we've got like a zero tolerance, you can't drink it. Then they have an office event where everyone's then allowed to drink, and completely contradicts their own policy with what they've said about no alcohol allowed in these in these circumstances.
Yeah, or it doesn't apply to directors or things like that. So yeah, it needs to, yeah, again, when you're looking at your strategy and your policy, is it a top-down approach, or is it just, you know, are you just doing that and to sort of what you say, the, you know, the frontline workers, so to speak, from there. We certainly see, obviously, when you're going onto sites and construction sites and things, you know, it will be a sort of a site induction piece, and that's great, you know, because you need to get the messaging out and it needs to be there. But, you know, we had one where we spoke to somebody and said, oh yeah, I could probably extend it by 30 seconds just to kind of get, and you're kind of going, 30 seconds really, is that kind of what it comes down to in terms of for us, it kind of, the education is a real key driver in terms of what you're trying to make sure sticks, and then certainly when it comes to prevention. The testing is the testing, and again, we try to make sure that people are using the tests that are right for them, and we will advise on that. But again, how that's working, there is a heavy reliance, certainly within the construction industry, of we'll just test and that will be fine and we're covered, we've ticked that box, but without kind of the thought of what happens out the back end if you get somebody that tests positive. So again, it certainly has its place within a strategy, and not kind of saying, you know, you don't need to do any testing, because it helps to inform whether your strategy is working. And then the final bit around support is, again, what support's going to be on offer. Certainly when you're kind of coming back to this, mirroring the strategy or the values of a business, is if you say you're going to look, you know, a really caring company, we're going to support and look after everybody, and we've got all these great benefits for everyone, but as soon as somebody tests positive, oh sorry, that's it, you're gone. It kind of contradicts. So it's looking at what that support is, and is it just tick box support to say we have this available, or is it really meaningful support that actually gives that person what they need, and kind of asking why are people testing positive in the first place, which is probably a whole different different conversation that we need to just probably address at a different time. But hopefully that gives you an idea of where it is, and you know, happy to share that. I mean, a question out to people that are on the call, you know, those that are, I mean, but do you have your own policies? Is it reviewed regularly?
Thinking Joanna and Paul, probably in your own businesses, you've probably got more insight into how it's managed and the processes for your drug and alcohol testing.
Yeah, I would say that we lack a little bit in the support side. We have a policy that clearly states, you know, if you test positive or if you refuse to test, that's automatically a positive. We educate people. We've done a bit about Alcohol Awareness Week as well, obviously testing people as well. But then, like you mentioned, if that person then tests positive, you're out or you're banned. That there isn't that support element, and we've had a couple of discussions about that, and hopefully we'll start looking into it more to revamping our policy, to make it more positive and more supportive rather than it being kind of in a way scaring people a bit, you know. But yeah, no, I totally agree with this model.
Yeah, that's great to hear. Thanks, Joanna. Thanks for sharing.
Well, and I mean, one of the insights I had years ago, I was a very small contractor who one of their employees had failed a drugs test, and we were like, also, what's your approach? How do you deal with that? And their approach was like, well, if we sack them, they'll just go and get a job tomorrow at the next company doing the same thing. There's zero consequence. Whereas if we support them and rehabilitate them, they're far more likely to stay a loyal employee. And actually, the benefit they get from the back of that was far greater. I think in construction, people are just scared because of the safety risk, and it means that they just want to follow the same approach that the industry seems to do, which is zero tolerance. You're clearly not fit for doing the job. Off you go, rather than ever thinking about the bigger picture. Which it's nice to hear more companies talking about it, but I still yet to see some that really embrace that and have the right models like that you're proposing, Nick. There's a lot of work to do.
Yeah, and we certainly see it in the slide that we've got up here, is this reactive approach, which is this kind of, you know, you test and then you sack, which is that approach, which is very much a reactive piece. And sometimes that's, I'll probably say, like, the drama of a positive test is kind of quite loud and quite like, oh, look, we've had a test, look what we've done. Whereas the actual work that goes in is the preventative stuff, which is sometimes the quieter, kind of slower way the real work is done, to kind of educate people so we don't get to this big sort of blow up and drama of we've had a positive test. It's you're trying to stop it ever getting to that position in the first place.
And the other thing, Nick, I think with the world of occupational health and data, people, like organisations, obviously now, like, we need to have data, we need to have metrics measuring performance. Like with safety, if someone's an accident, we can measure that KPI. When it comes to health, it's much harder to measure. So I always see drug and alcohol testing being the occupational health measure. So it's because it's the only thing that they can measure. So they do. Your kind of idea of saying people like the drama, people do like that because it feels like there's something that's going to happen as a result from what they're trying to do. But yeah, it's interesting to see how businesses respond and almost enjoy getting the results to be able to have something to report on.
Yeah, it's unfortunately, it's that kind of, we've managed it well, look at us for how we've done it. And you know, we're not here to sort of judge in terms of that, but it's like you've said already, Jenny, you know, is that solving a problem or is it just passing the parcel on to somebody else? So from there. So one of the things that when we work with a company, and this is just what we do, we always ask them what are their priorities for doing it. So, you know, there's things up there. Most people will kind of, you say, okay, yeah, that's fine. Certainly in construction, you know, there may be contractual obligations they've got to do. They might be in the supply chain. Health and well-being certainly sits within their productivity, performance. The key one, I guess you can imagine already, which is on there, is going to be safety. And that's what everybody kind of hang their hat on in terms of when you say we've got to do this because it's a safety issue and we have to do drugs and alcohol because we have to have a safe site. Certainly from what we're seeing is from going out on site and doing some of the testing, and also from talking to other organisations and some of the surveys that we've been doing, which I'll come on to later on, is that safety is in some way becoming lessened more and more, being chipped away at. So it's great to have it as that kind of tick box. This is why we're doing it. But then all of a sudden you can get things like timescales or deadlines coming. So, oh, well, yeah, we need to get that job done. So Dave really can't test positive today because we need him on site to be able to move the crane or to lay that bit of pipe work or whatever it needs to be in terms of that. Oh yeah, we're really behind on the budget, or it's going to affect the profits if we haven't got half a supply chain that can deliver it. So again, it kind of almost, it fits when safety fits, but when it doesn't, it's almost like, well, actually these things are more important, and which is the reality, I guess, of some things. You can get people that are saying, come back and test this person, or Nick's point, get heads up on when testing was going to take place, because they didn't want to be behind on that. So there's all these kind of things of kind of chipping away at what was always held as this kind of safety aspect. And that leads on really to the next bit that we've talked about already, which is this zero tolerance approach that organizations take. And I would just like to say I'm not anti-zero tolerance if it works, because we do work in the rail sector as well, and it works in there because the ban of that, there is a consequence to doing that. But what we certainly see with the construction is that it's hiding is probably the wrong way, and I don't mean that in that sort of terminology, but people just kind of put that up and kind of don't actually understand what is a zero tolerance approach to it. It's where we've just said they give them the heads up, or we've gone in before when there's been a positive test and they've said, can you come back tomorrow and test him again until he gets a negative, and then we can then report it back to the main contractor. So you kind of go, it's your money, but it's a complete and utter waste of time, and it's a bit farcical in a way because you're not addressing that person's issue. You've got to have zero tolerance, but you've kind of bypassed it in some way. So we did some surveys for, I don't think I can say who it is, but we're looking at the mental health of the construction industry and whether they could help to improve sort of some of the policies and the sort of code of practice moving forward. And obviously part of that included surveying around drugs and alcohol. And even when we were talking to like the site managers around, okay, so you say you've got a zero tolerance policy, just talk me through that. What does that mean? And they say, oh, well, we know if they smell of alcohol, we'd probably just say, I'll go away and come back tomorrow, sort of thing. And you kind of go, so that you don't have a zero tolerance policy then? Oh yeah, no, we do. No, you don't. You've kind of bypassed it. And the same when they're kind of saying, okay, when we're using these sort of tests, which we gave our advice, I probably wouldn't do that if I was you. It's not that accurate. And their answer was, that's fine, because we don't want to cap positives anyway. So you're kind of saying, well, is it just lip service? Are you just ticking a box to do that, or what are you actually trying to do? So I think this kind of blends into what you were saying, Jenny, as well, around getting the data and what does that actually mean? Because you could put in the random testers are coming, and I'm sure there's within every industry or any site that's there, they'll say, okay, yeah, the testers are coming, everybody knows it, but as soon as the first test goes live and people are walking, oh, there's emergency at home, or that the dog's sick, or I've got to pick my kids up from school, everyone's kind of gone. And we saw it on a site where half the workforce was gone. They had one positive, which was reported in from that, but the actual reality to the businesses is they had nothing done that afternoon because there was no one on site to get the work done, because they'd all sort of down tools and left, and we'll come back tomorrow. So the actual productivity then gets hit as well. So but to come to your point around how it gets passed around, the zero tolerance, somebody gets sacked under a zero tolerance policy, they still need to work. So they're going to go find work probably the next day, if not, wherever it is. So just a kind of an old school kind of approach, which I think it just needs a bit more kind of modernizing, I would suggest, from that perspective. So as we say, that preventative approach that we try to endorse, or would encourage anybody to kind of look at, is how do you balance those scales more? Certainly still have testing in there. Punitive measures remain there because there needs to be that element for certain people, but there's a lot more around support, education and training that kind of balances that approach out. And then this is the one that kind of talks around where the drivers are within the business. So who looks after it? Is it health and safety, or is it, you know, your health and wellbeing managers? And when we're sort of talking with our hat on as sort of substance misuse experts, it's a kind of a blend across there, but we certainly see it kind of sits within the middle, and kind of may not be the key driver for certain things, but is most often in the background, you know, of safety issues, of health and well-being. So more and more we're seeing with those stats that I put up at the beginning that there's a blurring of lines between health and well-being and sort of the drugs and alcohol, and how do we help businesses to kind of put it in to make things run smoother and better, essentially. Or when you're looking at it from your own perspective as businesses, is who looks after this? Where does drug and alcohol sit within that kind of wider piece, as you said, Jenny, within occupational health, or is it safety teams, or a blend across all of them, really? So certainly collaboration is needed across. Final bit around just employee groups that I just wanted to kind of run through as well. So this, we use this with our companies that we work with to kind of just give them an insight into what are they trying to do and what you're trying to achieve, because it sometimes can get a little bit lost. So when you're looking at the employee groups, we categorize these as 4 sort of main categories. So category 1, people that don't drink, they don't use drugs, they're able to understand what the policy rules are and they will comply with them. You'd have group 2, people that use alcohol or drugs potentially, but again are willing to comply to the policy rules. A large number, you know, I would sit in that category in terms of I drink alcohol, but you know, you tell me what the policy rules are, I'll hopefully be able to comply with those, and you know, not going to come to work under the influence. You then have category 3, which is, you know, your people that have a dependency on drugs or alcohol and potentially are wanting to comply but just unable to due to their dependency, and how do they do that? And then the 4th one is those that use drugs and alcohol but are unwilling to sort of comply to those ones. And those are the kind of ones where you see, like with your 4 cause incidents or things like that, you're going to kind of, okay, well, how do we manage this incident where it's come up? So really you're trying to stop categories 1 and 2 moving into 3 and 4, and you're trying to move 3 and 4 into 1 and 2, and that just kind of hopefully allows sort of businesses to kind of get an idea or a flavour of where their sort of employee pools sit, and how do they address each one of those. And there's ways that you can help and address each one of those pools by different bits of that strategy that we talked about with the pets at the beginning, in terms of how to.
It's a really good way of presenting it, Nick, because I think, my experience, people think you're focusing on the 5%. Like we're dealing with people that have got addictions, and actually when you look at it, it's like I said, it's only a small amount of people. More people are in the 4 category, and they're the ones that probably need a different approach.
Yes, indeed. Yeah, and that's how you sort of support them from that perspective. So I think that kind of leads on to sort of the support side, in terms of what support is available for people. So probably with more of the dependent piece, and this is just one of our services that we have, but it can be any, you know, there's great services out there. There's free ones that are available. You know, you've got the Lighthouse charity, there's Mates in Mind, there's fantastic ones out there that alcohol change. You know, you can reel them all off in terms of what those are. But essentially, if you were looking to support your employees, it kind of comes back to that culture and being able to provide a framework for people to feel comfortable to be able to come forward and ask for help. And that really comes through the education piece as well, is making, if you don't tell people that they can do this, how do they know that support is available? So being able to put that forward to them to show, if you come forward, this is the way that we will be able to support you. This is the way that we will be able to help. And there is, you know, we'll put our money where our mouth is, so to speak, and we will support you through this piece. Don't sit in silence and just hope that you're going to get away from the testing, because, you know, that's not a way of doing it. And you want to obviously have a healthier, safer workforce anyway. So being able to provide that support. That's kind of from that perspective. And the one thing I would say is as well, when we move on to this next one, which is positive change, and I put a few things out on, if anybody that follows us on LinkedIn as well, and I think Jenny, you kindly shared something on it as well around the article we did, was this approach of doing it is a different one. Is when we talked about those categories around, category 2, I think it was, people that drink alcohol and stuff. Life happens to people, it can happen. If my wife was to leave with the kids tomorrow, I don't know how I would necessarily cope. Would that send me into a spiral that maybe I make a bad choice or I make a bad decision? We are humans at the end of the day. And so being able to just to say everybody is expected just to be able to handle these pressures without, sometimes looking at unhealthy mechanisms. People will make mistakes, but does that mean that that is the end result for them? Or is there more of a sort of a supportive approach to kind of say, okay, you've made a mistake. Okay, we can't have that on site. It's a safety issue. So how do we address and support you with some of these sort of things? If they are a dependent, there is a dependency problem. This service here, Positive Change, it is not really for them. This is for people that have had a one-off kind of incident, life events happened. They've shown remorse and they'll be able to do that. So this looks at tackling that kind of test and sack approach, where you potentially would get offered it through your organisation, to say, we'll put you onto this. It's a 4-hour intensive course, supported by our charity partner that deliver our support services for us. And that's really looking at the behavioural change of why are they people doing this, what's driven them to use drink or drugs, and try and help and support that from a cognitive perspective. Rather than just kind of saying, oh, well, you've tested positive, so you've got to go and find another employment somewhere. It's an intensive course from there, and they get to speak to the specialists and get insight into what they're looking at. There will also be a couple of unannounced tests at the back end of completing the course. So again, making sure that they're sort of complying with what they've said. And they would also have access to those specialist support advisors for 6 months following the course. So it's just a different way of tackling that approach. And we come up with it because we were seeing a lot of problem between main contractors and supply chain. And it kind of is almost sort of saying, supply chain partners, they don't get the same level of support, naturally, of some of the employed benefits from the employed workforce. But they have a big disruption to any work that's going on. If you lose half your supply chain because they're all tested positive for cocaine, well, probably, where do you supply them from, with a shortage of potentially within the industry anyway? So this is just a different way of addressing that, in a constructive way, rather than just a kind of a hard line, right, you're gone. It's an investment.
And Nick, do you see, have you got the data that backs up that this approach results in a positive change?
So we've just, because it's quite a new service in that regard, we don't have the data to back that, unfortunately, Jenny, which is something that we would love to have. What we would love is for people to adopt. So we've launched it into a separate industry, funny enough, which is horse racing, which has similar kind of crossover to construction in terms of some of the challenges that they're potentially facing. But yes, we don't have that. So this was really designed to kind of support people, or give organisations an alternative, should we say, from that perspective.
Okay.
So, I mean, from that side of things, as I say, there's options there. I think the main piece in terms of, is it helping or hindering, to kind of come back to that question at the end, I think it really depends on what is those first steps that you're putting in place, because that kind of leads you to where you need to be. Talking with Nick, and there's a couple, Craig Payton, I don't know if you've come across Craig. Yeah, so fantastic work that he does, talking around sort of lived experience. We don't claim to have all the answers ourselves, from us. I think the only way that you're going to tackle it across society is a collective collaboration of stuff. And I know I've spoken to Nick around how could we do work with him, leading his message, is the things that we can perhaps bring in to work together. And that's working with organisations as well, to kind of say, look, you've got great stuff already there. How do we refine or plug bits into that to make sure that you're getting, because I don't think anybody has the answer. Yeah. It has to be a sort of a collaborative approach, I would say, from that.
I think it helps to have almost like a recognised framework to solve this problem, because I see more organisations saying that they will offer a supportive approach, but no, when you say, well, what would that look like? There's not this kind of recognised way that this is a good way of doing it. So hopefully maybe with some of this stuff there could be that, right, well, this is good practice example of how you manage that supportive element for that group of people that, you know, haven't got an addiction problem. Yeah, and getting that publicised more, because I think they still have it in the policy but don't know what it would look like if anyone was to ever come forward. And I think from an occupational health perspective, you see them going to occupational health provider and say, oh, we've got this person, what do we do? And they're all scrambling around trying to find an approach, but actually having it clearly understood, and the cost, because I'm sure it's an investment from a business to be doing that. They've got to make that decision.
you can kind of talk, like I think you put it very very well at the beginning. You know, somebody that's then, if you're supporting that person, yes, there is a financial cost associated to, you know, to pay for somebody to go on this, but that doesn't mean that the business has to pick that. There might be okay, well, it's an agreement, they're going into this with you, but we're not going to necessarily dismiss you, but this is almost like a separate contract. You know, if you agree to go through this and, you know, you don't have any positive tests out the back of that, we will support you. And there may be a bit of a monetary involvement, you might have to pay a certain amount to it, but again, it just kind of, something needs to change, I think, is what we're trying to say. Is because if you keep doing the same thing over and over again, it's not working. You know, you're just passing the buck around. So how do you look at something which gives you that flexibility to manage it? And it's the one thing I would say is this doesn't give everybody a free shot at getting a failed test. It's to be used at the discretion of the business. So if somebody turns around and sticks two fingers up to them and says, do you know what, cocaine's my lifestyle and this is what I choose, well, then this isn't the thing for them. But there are, you know, if they turn around and say, you know, I use my example, you know, my wife and my kids have just left, you know, I went down the pub on the Friday, did something stupid, you know, come to work on the Monday, been tested, and, you know, now I've lost my job. Well, where's that person's mental health at the moment? It's
I'm with you.
I'm going to stop sharing my screen because I seem to just be looking at myself and my own stuff. So there's a room out there of people. So I'll welcome any questions or anything you'd like us to talk through, or experiences, or anything that we can maybe help or suggest. I'm happy to do so now.
Anyone have any reflections or things that they've seen in the industry and how it's managed? Hi Veronica, Ronnie. Hello,
yeah, sorry I joined late. I was in another meeting that went on. So I think it's really good, that last bit there that you talked about. I think it is very dependent upon the business about what their policies, procedures and protocols are, and we have to follow them from our side. We do offer support after, if somebody's getting dismissed, we will bring them in and sit down, have a chat with them and point them in the right directions with things through the different charities and to what we have available through our EAPs that we have lots of. I think that there are cases where individuals have come to occupational health and have told us, I'm having a problem and I need help. Perfect, absolutely. Adult stage, perfect, holding the hands up and want help. I think some businesses that I've worked previously in would say, where's the evidence that they're actually doing something about it? How can we trust that this person is actually doing something about it? We don't want to know how the counselling session's gone, for example, for something, or the full extent of the GP unless we actually ask for a report ourselves. But what's the evidence there to say that we've put all this into this person? How do we know they're going out there and doing it? One would be, yes, we would see a change in behaviour. We'd probably not smell the alcohol. We would probably not be hearing bits and bobs about drugs or him denying or not. Do you know what I mean? Because we would get the results from the testing, but we also need to make sure that that's not just a one-off, because of the time that drugs can stay in your system for, different ones, different periods. When they're off, they might go bad on it again, and all of a sudden it's out with a few days later. Do you see what I mean? So I think it's very difficult to define, especially in a policy, how you treat things very differently. But I think you should. I think there should be something in there to say, just because we get a a positive after it's been to the lab and everything, why was it a positive? What's going on in their life? Do we actually look a little bit more into that to sort of say, yeah, we could actually do something to help this person? Because people are in safety critical roles, it is a policy that it's a zero tolerance where I work. No two ways about it, but they will get offered the support. But I do think there's a few lines that are a bit blurry.
Yeah, and I just to add that, I definitely think you're right in terms of that support aspect. The one that we had, so we partner with a charity called Aquarius Life. So they're based in the Midlands, and they do a lot of the support. You know, if you're routed through sort of GPs and stuff on that route, so they kind of help. And the support work that we've got, so called in positive support, is exactly that. How long's a bit of string? You know, as you're an employer, you point them in the direction of support, but how long do you know how to support them for? Are they engaging? Are they just, you know, for want of the better word, swinging the lead? So that allows you that ability to come back. So it is a two-way street. You know, firstly, the person that's coming forward and asking for support, that shouldn't be underestimated. That's a huge step for that person to come forward in the first place and ask for that support. It's brilliant that the support is there in the business in the first place, and then knowing where to route them. It's that handover piece of knowing where to hand them to is also vitally important, I think, in terms of you make the wrong choice or you put them down the wrong route, and it's not to say that it's everybody has the right choice. For, you know, what fits for one person might be different for somebody else, but having that sort of confidence, I would suggest, in the support that you're passing them to is paramount, not only for the individual but also for the business, and how do you support them back into that from there.
And just building on what Ronnie said, so with like the organisation you just mentioned there, would they give that feedback to an employer to say this is what we've been doing with them, this is their engagement?
So it's obviously confidential, so you wouldn't say, oh yeah, Nick's, you know, talked about this and that and whatever. But what they would say is, yeah, Nick's attended the sessions, he's engaging, we've built up a treatment plan, we're working to that treatment plan. And in roughly, 12 sessions time, we think he'll be, back to that position. And then once they've finished that, they'll then get a report back to the employer to say, yeah, Nick's completed it, we'll go from there. And then they're back into that kind of, hopefully back into full employment and the full swing again.
Yeah, and it is dependent onto whether or not within the business. This is why it's quite blurry in some stages. Is where do we put that person? If we have to take them off that safety critical role, we have to put them somewhere, and it could be a reasonable adjustment. But this isn't a work-related issue, or it may not be. It could be if they're stressed at work-related stress, all that sort of thing. We're there to help everybody, but if it's not work-related, they don't have to. But being a good company, if you're in a really good company, a very supportive company, they will look at this. And I think that's important, but there are a few blurry lines, isn't there? It's just how you get past all of that. But thank you for that.
No, thank you for that. I would just add to that in terms of where you say, is it a work-related issue? So we're doing some work with a rail construction up in North. It's quite a large project, and they had quite a large number of positives for their supply chain, and they were looking at, and they're doing night shifts and things like that, because it's obviously rail work, and they're kind of looking at it, okay, saying what starts off as like caffeine to get them through the night, is that then a couple of cups of coffee, to then moving on to 4 cans of Red Bull or Monster or whatever it is, to then, okay, well that's not cutting it anymore, so what do I add? So I then move on to amphetamines or something that's going to keep them awake. So, and obviously the stress of that. So there is, like you're right in what you say, Veronica, there's a blurred line between what is work-related stress, or has the work driven that person to.
Yeah, and you would hope that your ROC Health Service and your Health and Safety Service would be picking up on that from seeing them from a medical perspective and questionnaires and things anyway. If somebody was struggling and telling us that from how we deal with when we do our health surveillance, our safety critical medicals, you would hope that would be picked up. Do you night worker questionnaires, your fatigue management, all of that's in place, you should be picking that up and seeing a pattern. That's what ROC Health does. You see the patterns and you go in and think, right, we need to do a risk assessment here. Something's going on, and hopefully pick it up. And like you say, yeah, if that's what you notice, then that is up to us, because it is a work-related issue going on for that person, and or our night's just not right for that person, and do we look at changing that to them being on days if it's possible? So there's lots of different outcomes from one thing, isn't there? And I think as long as whatever service is helping to manage this in a business can have and see that many different branches off, how do each of us all manage that? It would be brilliant, really, to make this even a bigger, better thing in business. Do you know what I mean? Going forward. Well, thank you for that.
No,
I think you've just done a big advert for why people should invest more in their health services internally in a business. I think you're directly employed, so you've got that ability to have a more influence over of your firm. But lots of smaller contractors don't even see the value in OH, so you can see why they're at a bit of a loss to understand what they need
completely. I think
Yeah.
that's seeing the difference. Yeah, seeing something like looking at that. I'm not doing a big project on it. I'm not going to do a thing on it, so don't ask. But I'm too busy. But it is something worth looking at in the future, I suppose, of what are we, how are we all doing what we're doing, small or big.
Yeah, absolutely.
Thank you.
Thank
Cheers.
you. Sorry,
Thank you.
Polly. I know that we've
Polly, I was going to say,
yeah. Sorry.
had your hand up for a while. So.
No, it's okay actually, because some of you've just answered, but as you've gone through the conversation, it's actually changed what I was going to talk about. Because yeah, behavioural change is a huge topic, because it takes a long time for change, and it can take up to a year, if not longer, especially if somebody's got a trauma or addiction problem. So with that in mind, it's how do you then, go from treatment plans to then back in the workplace and empowering them. I mean, what is that step? Because as health coaches, we're registered and certified, so we're evidence-based, and we have to do everything ethically. But we start with a health profile to understand a person, and then we empower them by coaching, so that it's led by them, with skills, values, understanding food and mood. So there's lots of aspects to it, which could be, I don't know. I'm just wondering if this is kind of a solution or a stopgap to the next stage, to get them into the workplace and realizing how detrimental what they're doing to them is, and how to do just from food alone, you can improve your energy and your mood. And so, there's a whole spectrum here, isn't there, of putting the people in the right places.
Yeah, it is. And I think that kind of comes back to this. It's a collaboration in terms of somebody presenting themselves as there's a whole background to that, and having the right options and where to direct them, and where to put what. Hot sounds the wrong way to describe it, because to a very clinic, but where what pathway should I say to put them on to help them to get to where they need to get to. And that might be some of the different interventions, but it shouldn't just stop at one. There might be a crossover between another one. So what might start off with this service then moves into more of a community-based addiction services that help. I know Nick and Craig run those sort of ones where they're talking and support for people that have got lived experience, so that they don't fall into bad habits again, or addictions from there. So they've done the kind of the work, and then it's then phasing them through to how do you get that person back into a safe working environment from there. And I'm not going to sit here and sugarcoat it and say it's going to be easy and it's going to be cheap, because it's not. But at the same time, you're investing in people, and this is a people service essentially, although it's a safety aspect, and you kind of front end of that is substance misuse, and making sure the workplace is safe and safe and healthy. There's still an element of the people that go into building that business. I think that sometimes gets a bit lost in what we're trying to say is, it just becomes numbers, as Jenny said, numbers on a data sheet of how have we responded to this, rather than use this within a wider remit of services and insight to as you would do with an EAP, as you would do with your health surveillance and stuff. You use your drug and alcohol results to actually look at the insight into the business of what are we doing, what are we driving, what's the outcomes from that.
I think like when you talk to organisations about this kind of programme, this more supportive programme, there's no budget for that, but they'll spend thousands and thousands of pounds on testing, and see it as a completely separate thing. One of the projects that I was on before, you know, the budget was millions that they spent on testing, and actually think if you had that amount of money to support a construction,
prevention. Yeah.
I mean, what change would you actually get from that versus all the money on testing? But it seems to come in different pots. It's it just shows why in construction there is such a challenge, because that budget for that type of support is just not there for probably 95% of organisations, I imagine.
And I think the final bit, just to say it, Janelle, because I know we're close on time, but I think you said at the beginning as well, is from a construction industry and from any industry really, it's something new is also sometimes a bit like, oh, not really sure, we'll just do what everybody else has done. Well, what everyone else is doing is not working, essentially. So there needs to be a change. So it's kind of looking at those early adopters to be like, okay, how do we address this? How do we tackle this problem in a different way? Is what our challenge.
Well, thank you so much, Nick. And maybe when you get a construction company that's really adopting this, they get them to come and get them to come and share their experiences, because I think there needs to be more of those actual real life examples of a different way of doing this, which will really help. Thank you, everyone. We tend to finish a bit early, but this is a topic that I know that always everyone gets quite passionate and they're quite emotive about. So lovely to meet those that are new. We do send the recording of Nick's presentation out to those that haven't been able to attend today, but if anyone wants any more details, I'll send a follow-up email with Nick's contact information in, so I'm sure he'll be more than happy to come and respond or speak to you individually if there's anything else that you need. Brilliant. And Polly, I'll do a hand thumbs up. Okay, brilliant. Thanks all.
Jenny.
Thanks so much.
Bye.
Thank you. Brilliant. Absolutely brilliant. Thank you.
Thank you,
Bye.
Nick. That's great.
Bye. Thanks, Jenny. Thanks, Nick.
Thanks.
Bye.